Your Excellency, Dr. Zweli Mkhize, my friend, Minister of Health of South Africa, Your Excellency Daginge Ulstein, Minister of International Development of Norway, Mr. Pierre Delso of the European Commission, Department of Health and Food Safety, Excellencies, Act Accelerator principals, dear colleagues and friends. Thank you all for your continued partnership and thank you for joining us today. I would like to start by welcoming the United States of America to the ACT Accelerator. We're glad to have your support and involvement, and we look forward to your partnership in ensuring that all countries enjoy equitable access to vaccines, diagnostics, and therapeutics against COVID-19. We are at a critical juncture in our fight against the pandemic. Through a monumental global effort, we now have an array of vaccines, diagnostics, and therapeutics that can help us bring this virus under control. But we face significant challenges. International collaboration is increasingly fragmented and inequities are increasing, as we all know. More than 90% of countries now rolling out vaccines are wealthy. 75% of the 130 million deployed doses have been in only 10 countries. Meanwhile, almost 130 countries with 2.5 billion people have yet to administer a single dose. Many of these countries are also struggling to secure the resources for testing, personal protective equipment, oxygen, and medicines. The ACT Accelerator and COVAX facility were created to increase equity. But with every passing day, that goal is at risk. Countries are ready to go. COVAX is ready to go. But adequate supplies of vaccines aren't there early enough. The longer the COVID-19 virus circulates, the more it can mutate, potentially making current tests, treatments, and vaccines less effective. We have already seen several variants emerge that appear to be significantly more transmissible. And as long as the pandemic drags on, so will the economic impacts. Until we end the pandemic everywhere, we will not end it anywhere. This is not an empty slogan. It's a hard reality. WHO and our partners in the ACT Accelerator have laid the groundwork. We have created a dose-sharing mechanism, set up rapid processes for the emergency use listing, set up indemnification and no-fault compensation mechanisms, and completed readiness assessments in almost all AMC countries. But I see three major threats to the success of the ACT Accelerator and COVAX, which need our urgent attention. First, we must ensure the full financing of the ACT Accelerator and COVAX. We're grateful for the generous contributions to date, but we still have a long way to go. The financing gap for the ACT Accelerator stands at more than $27 billion for 2021. The longer this gap goes unmet, the harder it becomes to understand why, given this is a tiny fraction of the trillions of dollars that have been mobilized for stimulus packages in G20 countries. We call on all OECD and DSC countries to commit a proportion of stimulus financing to close the funding gap and to take measures to unlock capital in multilateral development banks. Second, we call on all countries to respect COVAX contracts and not compete with them. Some countries continue to sign bilateral deals while other countries have nothing. We have issued a challenge to ensure that vaccination of health workers is underway in all countries within the first 100 days of the year. We have 60 days left. We call on countries to support the global rollout of vaccines with dose sharing and donations of vaccines rather than to vaccinate lower-risk groups at home. We have made the moral argument. We have made the economic argument. No emerging evidence that variants could make vaccines less effective is showing that unless we suppress this virus everywhere, we could end up back at square one. And third, we need an urgent scale-up in manufacturing to increase the volume of vaccines. That means innovative partnerships, including tech transfer, licensing, and other mechanisms to address production bottlenecks. Your work as the Facilitation Council is vital. The success of this effort ultimately comes down to political decisions. I would like to express my deep appreciation for the tireless work of our two co-chairs.
Director General of the WHO, Dr. Tedros, and we thank the WHO together with the European Union for hosting this webinar. Welcome to all excellencies, distinguished ministers, dear colleagues and friends. At our last meeting, just 8 weeks ago, we had a sense of optimism that science had prevailed. Vaccines were available to the world in record time, an extraordinary accomplishment. The light at the end of the tunnel I talked about is still there, but unfortunately dimmer than we had hoped. Today's worries about numbers infected and dying are accompanied by concerns of the emergence of variants globally. In my own country, we are facing a particularly cruel variant that has escalated cases and sent an even greater wave of fear to our communities. The impact of this is having on lives and livelihoods is terrifying. On the continent of Africa, there have been 65,000 deaths and more than 2.6 million cases in the WHO Afro region, with a case fatality of 2.5. In fact, the total case numbers for the African continent stands at 3.6 million with 94,000 deaths. The continent is facing a second wave, which is centered largely on the southern sub-regions. Still, we must remember that the transmission varies so much from place to place, and therefore a second wave is not experienced uniformly throughout the whole continent. On 42 of the 47 of WHO African region countries that are now experiencing community transmission. There's also been a bit of some good news that over the last 3 weeks, the number of new cases has started to decline across the region. It is yet too early to determine if this is a decline that will be sustained in the coming weeks, or a third wave or resurgence will be experienced in some of the countries. So there's been a lot of fatigue amongst our health workers and amongst our communities, and this is important because despite all of that, we have to actually continue with the work of suppressing the transmission, which has gone on the past 11 months. This variant, coronavirus 501YV2, which has been first identified in South Africa, has now also been identified in other countries. It has spread rapidly to become dominant strain of the virus in our country. Data have indicated that it's also able to avoid antibody response, with a possibility of making vaccines previously developed on the wild less effective against this variant. Thus calling for all of us to take account of this and scientists to continue with their investigations to ensure effective vaccine. Additionally, the fears we had about global inequity are being realized. Well over 100 million doses of vaccines have been administered, and around 75% of those are in 10 countries. This is what the Director General has pointed out. Alarming and disappointing numbers, which we need to change in the way that things are happening. It has to be different to what we're seeing now. But we can only do that if we work together, and it's all about political choices that we make, and no one country alone can do this. COVID-19 doesn't respect national boundaries. We have a shared problem with the potential to share a solution. COVAX brought us promising news last week that vaccines will reach low-income countries within a matter of weeks. It is important to see that this multilateral model that we have all are contributed to and supporting it, that it actually works. We also need to stand behind COVAX and see all actors have a role to play. COVAX and X Accelerator, which is part of, needs significant funding to continue its mission. We've also great news from the team working to find new and cheaper diagnostic sets, with new diagnostics soon to be available at 50% of the cost of the current rapid tests. Vaccines alone will not relieve us from the pandemic. We have to invest in the entire package of treatment, tests, health systems, plus vaccines. Our meeting today, therefore, will reflect on the progress and show us in greater detail what fully funding X Accelerator will do and how we can secure that. Since our last meeting, the United Nations Secretary General called on the global community to fully fund the access to COVID tools accelerator, saying that the world's leading economies have a special responsibility, that science is succeeding, but solidarity is failing. Dear colleagues, let's heed these words and work together to ensure that the fruits of science are for all, not for the few.